Seemingly overnight, all my social media is showing me ads for beta blockers as an anxiety control medication. For example, Kick is recommending them for use before a big speech or salary negotiation to reduce symptoms of nervousness. I thought BBs, beta blockers, were for blood pressure and circulation issues. What gives? Is this real new science, or did some unhinged health influencer frat bro get funding for this stuff? Does this have anything to do with Parker Posey's White Lotus character and her lorazepam? You're welcome for the excuse to use that soundbite. Thanks, Aaron.
Hi, Aaron. It might be guerrilla marketing on the back of White Lotus, but it's definitely going to be our Sick of the Week. Sick of the Week. I guess beta blockers are joining the ranks of things like GLP-1s and ketamine and just getting the direct-to-consumer telehealth marketing treatment. A few things about that, though. Yes, beta blockers are used for certain heart conditions. They can reduce chest pain, prevent migraines, limit some tremors or abnormal heart rhythms, and even reduce blood pressure, though there are other better prescriptions that are usually used for that now. Because they work by essentially blocking the uptake of adrenaline, they can sometimes reduce those symptoms like sweating and rapid pulse. And while beta blockers are FDA-approved drugs, they are not FDA-approved to treat anxiety. Of course, a lot of stuff gets prescribed off-label, meaning that it's used in conditions they are not explicitly approved for, but the system of online prescribing is worrisome to me. Kick says you can get up to 48 pills from their site. If you have 48 instances where you need medication to get through a life event like a presentation or an interview, maybe you should talk to a doctor about underlying causes. Could you be depressed and that is causing anxiety? Could you have undiagnosed ADHD, which causes anxiety? Also, these medications have a lot of conditions and other medications that they should not be taken with. I worry about someone's ability to get a complete medical history before prescribing. If you have an undiagnosed arrhythmia and you get these meds, that could be really bad. So I worry these direct-to-consumer specialized prescription medication sites are only going to get worse as things are deregulated and decentralized. And my prediction is that it will be like streaming services, which were so exciting and so convenient at first, and then there were so many, and they started to buy each other up and started to bundle that they just reinvented cable TV. I think we are going to get to a point where there are so many specialized prescription websites that people are paying for that eventually they just reinvent primary care offices. So my sick of the week this week is going to primary care doctors. It's not a perfect system, but it's a lot better than whatever these guys are trying to do.